Yes, mga kakyuma, hagandahan, ang pag-uusapan natin ay breast cancer. Naku, ano nga ba ang cancer? Ang cancer po ay isang sakit na kung saan marinig lamang natin tayo ay natatakot na. Ang buong pagkatao natin ay nababalot ng nakakatakot ng mangyayari sa atin. Ang breast cancer para sa akin ay, naku, iba-ibang stage. Pag nalaman nyo, una, magagalit kayo sa mundo. Pangalawa, tatanungin nyo sa sarili nyo, bakit ako? Pangatlo, wala na kayong magagawa kundi tanggapin. Pang-apat, lalaban na kayo. Yan ang pag-uusapan natin, ang paglaban sa breast cancer kung kayo ay meron na. Paano nga ba itong gagamutin? Paano itong nakukuha? At paano ito maiiwasan? Gusto ko pong ihatid sa inyo ang itaong isang eksperto sa breast cancer. Wala pong iba kundi si Dr. David D.
Ang breast cancer ay ang malignant tumor ng breast. So yung bukol na patuloy-tuloy lumalaki at kumalat. Hindi siya benign. Ang benign kasi may bukol sa breast, puro hanggang doon lang. So pwede siyang lumaki, pero hindi siya kakalat. So ang breast cancer is the one that's uncontrolled growth and spread, and that can eventually cause the death of the patient. Maraming causes ng breast cancer. There's a genetic component, no? Approximately mga 15%. So may breast cancer genes na namana ng isang tao from her parents. Usually babae kasi breast cancer. Although may lalaki din na may breast cancer. So these genes are inherited. But overall, mga around 15% lang. Karamihan ng breast cancer, yun ang tinatawag natin na sporadic. Ibig sabihin, ang dahilan ay pwede sa environment, sa pagkain, sa exposure to carcinogens, radiation, other causes na hindi matrace na may kamag-anak na may breast cancer. Ibig sabihin din, pag walang family history ng breast cancer, hindi ibig sabihin hindi magkakaroon ng breast cancer yung isang babae. Pwedeng mag-self-examine na nakahiga or while taking a bath, nakatayo. Importante lang doon, may examine yung buong breast, both the right and the left breast. No? There's a clockwise, counterclockwise, up and down. If she does that regularly, monthly, then masasanay siya sa feel ng breast niya. At kung magkaroon ng bukol, mapansin niya, sabihin niya, oops, wala to dati ah. The best time to examine the breast or her own breast is between 7 to 10 days from the first day of menstruation. Ang breast cancer, anything, even in breast cancer, always starts with a single cell. Ang nagiging abnormal, nagsimula, iisa lang. No? So, one cell in the breast became abnormal. And then, naging dalawa, naging apat, naging 8, hanggang lumaki ng gusto. So, pag lumalaki na yung breast cancer, we call that carcinoma in situ. That's stage 0. So, that's very curable. Pag na-detect yan at nagamot, naoperahan, halos lahat gumagaling. Medyo lumaki na yan at na-invade na yung tinatawag natin na basement membrane, yung may lining. Pag pumasok na yan, we call that invasive cancer na. Pag invasive cancer, doon na mag-start yung stage 1, stage 2, stage 3, na stage 4. So for stage 1, yung bukol usually less than 2 cm at walang kulani. Ang stage 2 is usually more than 2 cm but less than 5. And then, may mga kulani na yan. Ang stage 3, mas malaking bukol, mas maraming kulani at kinain na yung skin or pumasok sa chest wall. Pag kumalat na sa atay, sa buto, sa lungs, that's stage 4 already. Pag may nakita na sa skin, for example, namula na yung skin, nagiging parang orange peel appearance, ganon, stage 3 na yun. Medyo advanced na yun. So, yung tinatawag natin na early stages, meaning stage 1 and stage 2, wala halos, walang naramdaman, walang makita, except for pag kinapa, may bukol. And that's the best time to diagnose and to treat. Kasi curable na curable yan. Kasi noon, pag sinabi na may breast cancer or cancer in general, parang death sentence, di ba? Ngayon, hindi na. Karamihan ng breast cancer ngayon, as long as detected early, is curable. And usually, it's done by a combination of surgery, chemotherapy kung kailangan, hormonal, yung tablets, or and radiation. So depende sa stage, depende sa involvement ng laman, ginagamit yung mga treatment na yan. Ang breast cancer is mahirap i-prevent kasi ang genetic component is only around 15%, no? Yung the majority, hindi natin alam exactly kung anong dahilan. So ang focus ng public health measures natin ay early detection. Ang breast cancer treatment is unlike before na we remove the breast. Now, kung ma-detect ng maaga, we can cure breast cancer without removing the breast. Tungkol naman sa yung 15% ng mga pasyente na may genetic causes for breast cancer, may genetic test po. Ang genetic test can be done through blood or through the mucosal swab, yung open your mouth and then we'll get some cells, ganun. Ang chine-check yung genes sa katawan natin. All of us are born with a set of genes. Yung mga positive for breast cancer gene, we call that BRCA, BRCA1, BRCA2. Kung positive dun sa mga genes, a person has around 80% risk for developing breast cancer. So that's very high. So if you are the person with that risk and you're only 20 years old, then syempre mag-isip ka na, in your whole lifetime, at 25, 30, 40, 50, 60, you have that risk. So it's like a time bomb. You're waiting. You don't know if it will happen to you, but there's a very high possibility. So one of the options that's being done is prophylactic mastectomy. So tatanggalin yung breast tissue, pero retaining the shape, no? So maglagay ng implant, ganon. Para pag wala ng breast tissue, then no breast cancer. The other way is to do, we call that prevention, like tamoxifen and other things. No? And the third option is to do a closer checkup. So instead of doing mammo ultrasound, we recommend regular breast MRI. So this genetic test will help the person. So for example, her mother has breast cancer. Her aunt, kapatid ng nanay, may breast cancer. So this young lady will be worried. She will think, maybe I have it too. But if she has herself tested and she doesn't have the breast cancer genes, then she will be relieved. So her risk for breast cancer will be the same as anybody else, not higher than other people. So yun ang usefulness. If you have it, there's something you can do about it. If you don't have it, then be happy about it.
Yes, mga ka-Q, naniniwala po ako that early detection is the only way para magamot natin ang ating mga sakit. Ngayon pong makabagong panahon, ano nga ho bang iba't ibang paraan para ma-detect natin ang ating mga sakit, lalo na ang breast cancer? Yan po ang gusto kong pag-usapan natin sa pagbabalik po ng Life and Style with Gandang, Ricky Reyes.